Tech innovators.
Hello, and welcome to Age Tech Innovators, the podcast where we explore how technology is transforming the way we care for vulnerable populations. I'm Monty, your host, and each week we chat with inspiring leaders who are making a real difference in the lives of vulnerable people, sharing innovations and ideas that help support and uplift those who need it most. Join us as we work together to build a brighter, more caring future for everyone. Now, let's dive in. So, I have the pleasure and honor of being with Caroline today. Caroline, run me through who you are and what you do in 60 seconds.
Thank you for having me on the podcast today. Um, Hello, everyone. I'm Caroline Hodge. I am a co-founder and CEO of Dimer Health. And at Dimer Health, we're bridging the care gap between discharge and home. And we're doing that through both technology and care service delivery. So we are a company made up mostly of providers, so PAs and doctors that have been working in healthcare for many years and have witnessed this gap. We have seen patients come back to the hospital time and time again because when they left, uh, they weren't able to follow up quickly. They didn't understand their discharge instructions. They didn't have the resources that they needed, and really were left to their own devices. And we know that there's a better way to help take care of people after they leave an institution. So we've been growing and scaling and doing all sorts of cool stuff, and I'm excited to tell you about it.
I can't wait to hear. Before we jump into specifically what you're doing in the business, how did you get involved in this space? I'm always curious about how people enter the health space.
Well, sure. This could be like a really long story, but I'll try to make it
There's no
fast.
rush. There's no rush here.
I actually started my career. I come from like a entire family of healthcare people. Um, but I think going into medicine was super natural for me. But I started as a PA in emergency medicine way back in 2006. So I spent about 18 years working as a provider. And from day one, I was like, wait, why can't I have this patient follow up to have their stitches removed or their wound checked or to make sure they're taking their medicine like the next day? I remember my very first day working, being frustrated I couldn't get someone a follow-up appointment somewhere. And very quickly, I rose in leadership. And um, 18 years later, I was in a national role working for a big company, and COVID hit. And I had this like epiphany where we were triaging ventilators and figuring out protocols for patients of how do we decide who gets what treatment. And people were staying home instead of going to the hospital, and we couldn't get healthcare to people, yet we could get an Amazon delivery to them in 2 days. And I was like, this makes no sense to me. How come we can't do better for people? And that's actually how I ended up in startup. So I um, just wanted to move faster. I wanted to get things to people real time in my lifetime. And so that was the clinical side of me. And as a clinician, my frustration prompted a jump. But personally, I also have been a patient. I've had breast cancer twice. So I've had when I was 34 and when I was 38. And I've also been on the receiving side of healthcare, and I've been the receiving side of amazing, amazing doctors and nurses and providers, but also received failures from the system as well. And I think I just, I love the beauty of helping others and the beauty of healthcare and healing. And I think that we've been doing things in healthcare the same way for hundreds of years, and we could change our approach. Now we have technological advances, we have the capabilities, we have new ways of utilizing our resources that if we can sort of look through our glasses the other direction, like flip them around, the resources that we have can be pieced together differently to provide better care more efficiently to people. And I just am obsessed with that. So that's how I ended up here.
Wow, what a journey. It's
Yeah.
very rare to talk to someone who is so young, who has had such a experience on both sides of being a provider and also having received support and care. How is this shaping your scaling of your business? How do you find having that actual personal experience feeds into the growing of your business? Just out of curiosity.
I think I I would like to say that like my personal experience being sick is like, the thing that created this like vision. But I think as a clinician, I knew the problem and I knew the solution. It was just I was like in the rote of my life and, I had the comfort of a good job with a good salary, and I always was creative and had ideas, and I brought them to my job. Sometimes they got heard, sometimes they didn't. But I think being sick and feeling the pressure of time and not knowing if I had it um, gave me this perspective of like, I don't care if I fail. I want my time to be purposeful and I want to do big things and I have my hands here to build and like I just want to go. So failure became way more scary than not going, not trying, not fulfilling what was in my heart, I think. So that's got me to do this crazy startup journey, which is so hard. So it
That
is.
is a beautiful, yeah, a beautiful takeaway from that. I feel like people can go two ways where they start to, it's almost like it drains that experience is so draining that it's hard to say, I'm now going to build a business. Whereas sometimes you can see it as a, okay, now to really do something impactful and really meaningful. So
Yeah.
where do you've had personal experience in this space, just working in the industry. Now you're running co-founder of a business doing this. Can you run the listeners through a little bit more what you're actually doing at Dymo Health?
So essentially what we do is we're bridging that care gap after a patient is discharged. So what happens is what so essentially what the problem is that people go from um, hospital stay where they're taken care of. Everything is decided for them. They get 100% of decisions made for them while they're in the hospital. So they get their medicines given to them. They get their specialists come visit them. They get told when to go to the bathroom. They get everything is done. Physical therapy comes to them. And then as soon as they go through the doors of the institution, um, they everything falls on their shoulders or their caregiver's shoulders and it's an incredibly vulnerable time and it's a lot to put on people and what I do know from work that I've done in the past and what research shows is that if you can intervene with a clinical hand within the first 72 hours you can change the trajectory of someone's outcome. I almost knocked over my water.
That's cool.
I'm a hand talker.
Your
The
brand,
trajectory,
it's your branded water as well, just to show
yeah,
the brand.
I was there. Um, so we can change the trajectory of someone's outcome. And anything after 72 hours actually doesn't really change ultimately whether or not they come back to the hospital. We are creating new specialty in medicine, transitional care medicine. So very much like hospitalist medicine was a wild idea 20 years ago, where people were like, why doesn't my primary care doctor take care of me while I'm in the hospital? And there's a lot of reasons why. And the hospitalist specialty emerged. Now the hospitalist can hand the patient off to the transitionist, which is us, and we'll take the patient's hand and guide them as they transition out of the hospital into back to their home. And we'll provide 24/7 ongoing support and care and resources for them until they can be handed back off to their primary care doctor or their specialist. And I think one of the things that's different about us, which is I think some is different. Is that we're not nursing, we're not case management, we're not social work. We're literally a medical practice that's specializing in the medicine of transitional care. So this is a time when a patient's health status is vulnerable, they're in flux, they're in a more acute state when they're discharged until hopefully they're improving to the point where they're back to baseline and they can be handed back off again. And I think that right now where length of stay is getting shorter in the hospital, I know I'm on a long tangent right now.
No, no,
Length
no.
of
Appreciate
stay
it.
is
Keep going.
getting
Keep going.
shorter in the hospital and care is moving into the home. primary care and specialty practices are getting maxed out, and really the time that they have is getting less and less to be able to really care for the people that have more acute needs in the home is being there's less resources for that. This time where they're alone and vulnerable is greater and greater. And so I really think it's just been a natural evolution that this need has emerged. There, that's what we do.
No, that's huge. And so, from a technological perspective, where are some of the, you mentioned this is helping the transition for people leaving hospital, and as there's less capacity or capacity is more strained in hospital, people are being pushed out
Right.
earlier and earlier. Where do you see some of the innovations are from a technological perspective in helping this transition?
Sure. I mean, honestly, like we have an endless roadmap of ideas of, what we can do and then what we are doing. Everything we do is virtual, so all the care we deliver is virtual, and we're using technology for administrative duties like automations and data extraction and things like that. But we're also using technology for telemedicine, so to actually do the care like we're doing here. And just like side note on that, there's a ton of opportunities in these conversations that we're having. I mean, literally, I think telemedicine, also side note, by itself is a great tool to have for certain episodes in a patient's care journey. It's not perfect for everything, but especially during this time, right, when people come home, they're they're in pain, they're on medication, they've got healing wounds. I mean, to have someone get in a car or have to travel to get to a doctor's appointment, if they're elderly, people might have to take time off of work to take them. I mean, it's just a resource. I think it's such this is such a great tool to have during this particular time. We actually had a patient last summer that it was like a 98-degree day, and he had just come out of the hospital, and he was a 80-something-year-old male, and he ended up passing out in the parking lot because it was so hot, and he had just like had surgery, and it was like so unnecessary for this poor man to be out just to go for a follow-up appointment. And anyway, all side note. So we're using technology for telemedicine, and then we're also using AI to help take all of this like really great information we're able to gather out of the electronic medical record and the information that we're gathering from our visit with the provider that we have right away. And what we do is we risk stratify the patient, and then we're able to come up with a customized care plan for that person. And as we continue on holding their hand, we're able to literally have we don't, it's not like a one-stop shop where we have this visit and then like you're good to go or you're not. Like it's predictive, proactive, continuous, personalized care. So via various mechanisms, we'll stay engaged with the patient and communicate with them and check in with them. And so we're able to dial up or dial down that care and that cadence of interaction and type of interaction based on how they're progressing through that care plan. So someone, for example, might say they'll have their visit, and then the next day they'll get a check-in and say, you know what, I'm great today. And then, they'll get a check-in the following day and say, one of the questions we ask, are you having any new or worsening symptoms? And we actually get this quite often, this response. And they'll say, I'm more tired today than I was yesterday. And that can mean a lot of things. And one of the things we worry about is an infection. And so somebody that answers like that, we might say, you know what? We're gonna turn up that volume and do a little bit more for you and keep a closer eye on you to make sure this doesn't exacerbate. And so we're able, instead of waiting for that patient to develop that fever, to become weak, to pass out, to have, a big rash or whatever it is that wherever their infection is, we can proactively watch it, get on it quickly, order labs quickly, order medications quickly, and take care of them so that they don't have to go back to the hospital, or if they do, that maybe it's an overnight stay versus an ICU stay. And, there's that fundamental, I have this like, I'm super passionate about this, but I really think at the end of the day, what the patient needs is our North Star, always doing the right thing for people, and the business case follows. And, you do that, the patient's outcomes are better, the cost of care is better, the resource utilization is better. Um, you know, everybody wins in this game, everyone. And if you start with the patient and what the value is to the patient, everyone wins. So.
That is that is lovely. I really appreciate that. It's a very, very thorough answer. It's really cool to hear is that you're aggregating the data that you're collecting around the patient to create customized, proactive, preventative support. It's something that we've seen as being discussed a lot in the industry, but hasn't been widely implemented to the extent that it definitely can be. What do you think some of the challenges are to taking this model, which is this personalized, preventative, proactive, and support, and actually scaling it up? What are some of the challenges for people who are doing this?
Um, Gosh, I think there's like a lot of challenges.
Honestly,
Um,
you can go niche. This is the perfect place go niche on it.
and I mean, and at the risk of being like slightly controversial too, think I think there's a lot of challenges. One of it is the way we do payment, and I think one of the things like you mentioned briefly before we even started the podcast was like the RPM and telemedicine, and like I actually wrote a blog about this. I haven't put it up yet, but I've been thinking so much about this because like I'll rattle off a whole bunch of acronyms like RPM, CCM, TCM, APCM is new, and like all of these ideas about how can we be proactive with patients and recognize patterns in patients and get to them early, and they're structured in a way to like try to provide payment for this work, but honestly it's all trying to move in this one direction, but it really just creates silos, and it's difficult. I think we're getting there. We're trying to move in this direction, but really it's about a modality of care. But right now, the way our payment models are structured, it doesn't it we really just need to adopt this as a model of care for everyone, not just for certain populations of people. So, not just for patients that have Medicare because Medicare will pay for it, or not just patients that are joint replacements because there's value-based payment models for that. It really needs to be, we do predictive, proactive care for everyone. I actually, I think we spent like $5 trillion in healthcare in the US last year. And um, gosh, I think, what is it, like 60 something percent of it is on um, people with chronic disease, and 30% of it is on not on chronic disease. But that's still like that 30% is still a lot of money. And so we do a lot of like looking for like the high impact, like I always use the analogy like the juice to squeeze ratio. I think it's a really funny metaphor for some reason. And I think in healthcare we look for those like high impact, low like lift wins to save money. But I mean, we're talking about like $5 trillion, 30% of $5 trillion is a lot. So if we can create solutions that are ubiquitous solutions that apply to the population, that are predictive, proactive, and as we create, like what we're doing is we're building this data set where we're able to apply the knowledge that we're gathering from the people that we're caring for, and looking at these the patterns in them and being able to apply it to the people that come after them, and be able to recognize these patterns and then be able to predict what's going to happen, and what these patients are going to need, and apply it to the population. And I think that we'll be able to provide better predictive, proactive healthcare for everyone this way. And I think we've got startups that are working on it on like pockets, but I think what we've discovered is we're starting here in this transitional care space, but what we're learning and what we've learned inside Dimer Health is that this is just a model of care delivery, and it's a model that works, it's effective, it's impactful, and patients love it. Like they love it. Like I can't even tell you, people are like, why isn't care always like this? And you know why? It's because this is how I want to be treated. It's how I want my mom to be treated. It's how I want my friends to be treated. It's how I want you to be treated. Like it's how we should be treated. Also, side note, I think in healthcare, as leaders, we tend to think about patients as other than us. You know, the truth is, when we are building and we're innovating, and as we are creating policies as policymakers or um, in the payer world as, leaders in the payers or health system leaders, everything we decide and everything we do and every initiative we start, like I think we have to remember that one day, if we're fortunate enough, we're gonna be older and be on the other side of the bed and we'll be the one in the bed. Or if we're less fortunate or whatever, we might be younger and in that bed. And is this are we building something that we would want for us or for our children or for our parents? And it is our system. So I think that is slightly abstract, but I think about that in every decision that we make. Like, is this something I would want for, is this is this a build that's going to be sustainable and last and what I would want for the people that I love the most?
I really appreciate your such thorough answers. If it's any,
So
if there's any
so
reassurance,
chatty.
a lot of the time whenever I talk, I open up thought threads and then go off on tangents and then have to come back and then have to go and close off these thought threads as well. So I appreciate the fact that you explain things in this way. So you're talking about how one of the key things is to ensure we're creating technology that would be suitable for ourselves and we treat ourselves like the patients that we're ultimately supporting with our technology. And you mentioned some of the issues around funding, somewhat silos people. So, the funding structure and how people tend to go and just figure out how can we create as much money for as a business by going after these target groups, which are most easily reimbursed by insurance companies. And that means we're missing out on potentially supporting a key group of the population who still require assistance but aren't so heavily reimbursed. What are some of the things that you're learning about actually entering the market that have surprised you or that you finding are working really well? And I ask this because I was talking to someone, I was talking to a policymaker a while ago, and she was talking about how there's often great technology and there's people who need that great technology, but the people who have great technology don't know how to engage with the people who need that technology. The people who need that technology don't know how to engage with people who have the great technology. So how do you see market penetration being something that you're learning around or something that's yeah, yeah. What are your thoughts on that?
Yeah, so I think product market fit is the hardest thing, for sure. And I actually think that's a super astute point. I in my the last company I worked for was a startup, and I worked with the M&A team as like their clinical eyes sometimes. And I tried to be like a sponge. And after watching so many people with great technologies present their products, I realized that the biggest thing that they were missing was that they didn't know how their product fit into the healthcare space. And I talked a lot when I was at that company about healthcare culture. And I think the president of the company at the time was like, "Have you say healthcare culture one more time, I'm gonna like kill you, Gary." And I was like, but you have to realize like there's like a pulse to this. It's like, a new language that there's the invisible thread that ties those words together. Like it's really important to know how what you're bringing into the industry, even if it's brilliant, is going to impact that. And so I like there was somebody actually that had it was a cardiac device, but it was for a condition that a patient would use that also had like 5 other conditions, and they would need other devices for those other conditions that were more important than the condition that they were treating. And I was like, when they presented it, I was like, I don't think that patients will ever use this because they're already going to be doing blah, 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 blah. And I was like, you know what? If I ever do a startup, which I'm never going to do, if I'm not crazy enough to do that. If I ever do a startup, I'm going to open up a medical practice and carry the torch of my product because that is, I think, the only way because healthcare is just too slow. Because I did also dabble with the sales team and trying to get in with healthcare systems and payers, just the sales cycle's so long. And I was like, we also just have to carry the torch of our innovation and also need to have a business model that generates revenue to help sustain what we're building as we're building it. Just basic business.
That's so interesting. So you're also, in addition to a SaaS product, a healthcare practice as well.
So we're not selling our software yet. We're building it as we're building it for ourselves right now and looking to start selling our product, our platform more so in the next couple years.
Wow, next couple of years. That is some patience and long-term thought as well.
It's big what we're building.
That's so interesting. So your idea was, what can we do to learn? It's almost like you have the you're not having to worry about getting the initial set of first customers. You're creating almost yourself as a customer, and then you're iterating into product to streamline that as much as possible, and then you'll go and roll that out to other customers. It's an interesting approach.
We also, by creating a medical practice, don't need to have we're not dependent on health systems or payers. So we can have that doctor to doctor relationship with practices. And so our customers are these practices and we get referrals. So we essentially are a medical practice and we see patients. I mean, we've grown like, we started almost like a little over a year ago seeing patients and billing for patients, and we've grown 15x in less than 12 months. Like every physician that thinks, every physician that hears about us is like, this is a huge problem. I can't handle my patients. Like, I want them to have more. I don't have the bandwidth for it. I don't have the capacity for it. And um, I want this. Like, you'll be my partner. We'll work together. And they love it. And we actually are working with a health system right now that is like, we love this. We want to bring you, we've been working with all the physicians like around them, and the head of the health system is now, we want to participate in your next round and bring you in formally, and like, this is awesome. Our patients love it. All I hear is how much everybody loves us. So yeah,
That is a
I'm
really
really excited.
exciting option.
Thanks. Yeah, I'm really a psycho though about like patient satisfaction. Like, I am insane about it. So I just think there's nothing more important than that. And second to that is our like staff satisfaction and the referrers satisfaction. Everything else works after that.
It's true. I quite like, as a super quick side note, I was reading Jeff Bezos's stakeholder slash shareholder letters. Have you read these?
Yeah, I should, I guess.
It's so good. What it's like the blueprint of how to build a high growth software business before there were blueprints. He was one of the first to do it. And he talked about, in his first ever stakeholder letter, talked about, time and time again, being obsessed with the customer was the most important thing. That was the most important thing, over and over and over and over and over and over and over again. It's all he drove. So it's really cool to hear you being so obsessed with patient
I think that's
satisfaction.
really cool that you just compared me to him, so thanks.
I didn't realize that, but that's awesome. Yeah, 100%. I mean, it sounds like you're onto a really, really exciting future, and it sounds like you're helping a lot of people right now, which is super critical. Got, well, I can't believe 30 minutes has gone by so quickly. So a couple of quick questions to tie up, and thank you so much, as always, for your time. The first one is for people who are interested in entering the space in the telehealth, telecare, the healthcare system, potential founders, potential innovators, people who may be like yourself, who said, I'm never going to do something, and then actually going to think about doing something and doing something. What would you say to these people to encourage them? What words of advice would you have to people who are considering entering into the healthcare telehealth space?
Like the startup space, or just like wanting to join a company, like to do a startup?
Yeah, startup
Um,
space.
I think that, gosh, I think, I think like if you have a dream, I can't imagine a life where you don't go for your dreams. And even if like it doesn't work out the way you had envisioned it, all the lessons you learn along the way are going to open up doors to new dreams. And like, there's nothing better than I just, I'm like super philosophical about this. My daughter always makes fun of me, but I just like, there's nothing I think more fulfilling than a life that's like spent putting the building blocks towards your purpose. And whether it ends up looking like the house you thought you were going to live in or a totally different house, because I am like definitely not in the house I thought I'd be in at this point in my life. But I say go for it. Like, just get started. You have no idea what you're in for. It's going to be more amazing and more painful than you can imagine. And go.
It's so true. I really appreciate that. It heavily resonates.
Yeah.
And my
Yeah.
last question is if we fast forwarded the clocks 60, 70, 80 years, and you suddenly looked in the mirror and you were 80 years older than you are now, so you're an elderly woman, and you look in the mirror and you go, wow, I'm feeling a bit stiff. Uh, and you then start to think about your day and what kind of day you would like to live and the technology and support around you. What would it look like? What would an ideal day for you where you need the most amount of care towards the end of life? What would that look like from a tech
I
perspective?
like love this question, by the way.
Thanks.
Because I like really think that we talk so much about like value-based care and healthcare, and like the unit of value should be on the patient to define what that is. For me, like it is time to live my life on my own terms, and wherever that is in that point, wherever I am at that point in my life. I think at that point, like I'll want to be, I also am like super corny, but like I think the biggest driver of like purpose in anything is love. And I will want to be doing the things I love with the people that I love, not sitting in a doctor's office waiting for my appointment, not trying to find rides, not trying to manage my medications, not, gasping for breath. Like I want to live my most healthy, meaningful, purposeful life filled with the things that fill my heart as long as I can. And I want technology to make that possible. And I want humans to allow that to happen.
That is, you've got a nice poetic way of speech, and that was a nice poetic ending to a really enjoyable podcast. Caroline,
Thanks for having me.
no, honestly, thank you. I really, really enjoyed this and learned a lot. Really excited to see what the future holds. And thank you again. Look after yourself. Peace.
Thanks.
Bye bye.